A migraine is a very painful, recurring primary headache condition. Migraines typically produce much more serious and painful symptoms than other headaches. Even some forms of migraines don't cause major head pain, though. Secondary migraines occur as a side effect of another illness, like an infection, chemical overdose, stress, or drug abuse. Sometimes they can even be a symptom of more serious underlying issues. Many people suffer from migraines on a fairly regular basis, but what causes them varies from person to person. A person with migraines may not even be aware that there is a problem. In fact, many people who have migraines may not realize that they are sick, too. While migraines are very painful, some people hardly feel anything at all when they have them. Headaches are classified according to the location of the pain in the head. Common migraine headaches usually affect the lateral or frontal parts of the head, while cluster or pulsatile migraines affect only the temporal region of the head. Migraine headaches can also be very intense, lasting several hours at a time. They can also produce very intense nausea. Some people believe that headaches are caused by psychological problems, but there is no evidence to support this theory. Stress, anxiety, and certain medications may trigger a headache. However, headaches are also caused by blood clots that can be caused by physiological abnormalities such as cerebral palsy. Some medicines may also interfere with headaches, including some forms of aspirin. There are many different methods used to treat migraines. Some people say take certain medications as ways to help reduce the intensity and frequency of migraines. Consuming foods that have lots of vitamin C, like citrus fruit or cold-pressed lemonade, can help reduce tension. Certain medications, including beta blockers and anticonvulsants, can help to alleviate headaches caused by these triggers. When you eat or take certain medications, it's important to let your doctor know so that your treatment can be altered to accommodate the medicine. If you suffer from migraines that last for more than 6 weeks, you should see a doctor. He or she will do blood tests to determine if you have migraine status migrainosus, a condition that requires treatment with special medicines. Sometimes these medications can cause rebound headaches, meaning they can be caused by using the same type of medication and then stopping it. Doctors will often recommend treatments for headaches that last for more than 2 weeks. One of the common triggers of migraine smells. If you've got a smell that always bothered you when you were younger, it may occur when you're getting migraines. Smells that are familiar to you, like vanilla or candy, may not bother you so much now, but they may occur more frequently when you're suffering from this condition. Migraines come in many shapes and sizes, and they can feel very intense at times. You should be able to find one type of headache that makes your life miserable. Migraines can be triggered by anything from exercise, the weather, stress, and even chewing on something hard. The intensity and duration of your pain can vary, and you may not experience migraine pain every time you have one. However, knowing the triggers can help you stop your migraines from occurring too frequently. One of the main risk factors for getting migraines is if you suffer from one side of your head only. This can be compared to having double vision in one eye. Your brain needs to use both sides of your brain for processing. This condition is called hemifacial bipolar disorder, and you may also experience symptoms such as decreased consciousness and slowed reflexes. If you experience 2 or more of these symptoms, you have a greater risk of getting migraines. You can prevent migraines by avoiding triggers that usually cause you to have headache pain. The 2 most common triggers are exercising and traveling. If you do exercises that trigger your headache pain, you should avoid doing them altogether. Traveling can be another trigger for your migraines, especially if you are going to be flying. Always make sure you lay flat on your back for the flight and try to sleep with your head elevated. Some of the other things that can trigger migraine headaches include light, sound, smells, and touching. Light causes your vision to become blurred, and the sound can sometimes also jar your senses. Touching your head and shoulders may even increase your sensitivity to your headache. Other smells may include cologne, perfume, and new shoes.